Hello, everyone, and welcome to today's webinar from Diagnostic Solutions Laboratory, the role of parasitic infections in chronic health imbalances. This webinar is presented by Dr. Dan Kalish. Dr. Kalish is dedicated to teaching doctors functional medicine philosophy and practices. He has trained over 1,000 practitioners worldwide in the Kalish method, which solves patient challenges through a proven lab-based approach by means of the Kalish Institute's educational programs. Whenever you are ready, Dr. Kalish, you can begin.
Thank you very much for bringing me back. And so we get to talk about one of my favorite topics, which is the role of parasitic infections. And for those of you that are brand new to this, the first time you heard me speak, I've been around for a while. I've been, like longer than I want to think about. 27 years I've been doing this job. I don't know where all that time went, but in the midst of these years, I've managed to do all kinds of different things. I've worked for several different lab companies, was pretty heavily involved in the development of parasite testing at one of the older lab companies a long time ago. Spent a lot of time with parasitology experts and was quite fascinated about this aspect of the job, 25, almost 30 years ago. And things haven't changed much since then in terms of parasitology. It's all about the same. If anything, people are getting sicker and more often. I've also been involved in research studies. I'm working very closely with Richard Lord now to develop some more advanced curriculum on lab testing. I'm still in practice to this day. We have a couple of specials coming up for people who listen to this, discounts on our boot camps. So in April, we'll be doing a lab interpretation boot camp, and that is on amino acids and B vitamins, and it's an in-depth dive for 2 months into lab interpretation of this pretty complex area of amino acids. We're going to look at 4 different cases: a healthy athlete, a depression case, an insomnia and anxiety case, and one on chronic fatigue, and get into how you can interpret amino acid and vitamin testing at a high level, which is what they call that class. And you get a 20% discount if you're interested. You use the lab code based on the Diagnostic Solutions Lab, so DS 2021. And then in June, another new class, haven't taught either of these before, on functional genomics and really looking at the common SNPs and how we can interpret existing functional medicine labs and correlate them with the SNP testing that is really popular out there. And again, you can get a discount on that class. And that's an area I think that's kind of the up and coming subject for all of us, really, is understanding how to coordinate the genetic testing with the other functional tests that we do. Anyway, so those are coming up. You get discounts on those if you're interested. Check them out. And then for today, we want to talk about the types of patients that are going to benefit from a parasite test. Understanding the work you need to do prior to and during parasite treatments to make sure that these work well. And then understanding the connection between parasites and human health, the immune system, stress, and why these infections are even a problem. And I don't know, for me at least, as soon as you say the word parasite, it just sounds a little dodgy. It sounds a little bit like some kind of colon cleanse that you're doing based on some late night TV ad or something. But these are pretty serious infections and pretty serious problems. There's an old book, which if you haven't read, it's worth probably buying. You can probably get from Amazon for like $1.99 or something. Guess what came to dinner? And it's a nice little intro to parasites if you want a little refresher on it. But the thing that's interesting to me is, like, if I look back on my first couple years of practice, I never ever would have dreamed how many patients I would treat in these last 30 years that where their main problem was really a chronic low-grade digestive tract infection. Like, I mean, I learned about this and you can kind of hear about it and you go to conferences on it, but it's hard to wrap your mind around what these low-grade chronic infections can do to people over the course of decades. They're way more common than you would imagine. They're very difficult to find on labs. Very few people that I test in my practice have any idea that that's what's going on, and they cause so many problems. It's, again, hard to wrap your mind around. And then the biggest problem amongst all the problems is that they don't really display obvious symptoms. I mean, if somebody goes to Mexico and they come back and they have diarrhea every day for 3 weeks, that's an obvious parasite infection that needs to be treated. But we're not talking about people like that. We're talking about people who have chronic fatigue or depression or anxiety or a sleep problem or something like that. And it's not obviously tied back to a trip that they took overseas somewhere when they got really sick that was 15 years ago. The problem with these kinds of low-grade infections is because in integrative and functional medicine, we're using nutrients and diet to improve people's health. If you don't clear up the gut problems, you're going to really, this issue will just undermine everything else that you do. And chronic low-grade inflammation in your intestinal tract from crypto or Giardia or blasto or histo, it'll ruin everything else that you're trying to do. And you'll have these patients that just won't progress as you would expect. So if you're ever wondering, do a test. If you have patients that aren't progressing as you would expect, you should test them. If you've got a new patient, you should test them. Just basically test everybody that you can. And in fact, about 1 million years ago when I worked in this lab, they had this guy named Jerry was one of the people that worked there. He was kind of a character. He was like a Hollywood script writer, but he gave up his job to come work in the lab. It's this whole other long story. But he had this t-shirt made up for all of us that we wore for like one day. And it said on the front, do the test. And then on the back, it said, or die like the rest. And if you knew Jerry, his sense of humor was pretty good. But, it's hard to get people to do stool testing, but once you understand how important this is, you feel like walking around with a crazy t-shirt like Jerry had. Okay, trying to wrap my mind around why is this idea of chronic parasitic infections so just not paid attention to, certainly in conventional medicine and to a great degree, even in integrative and alternative medicine, most doctors don't run parasitology tests on every single new patient, which they should be doing. And I think back to the 1800s, there was a man named Joseph Listerine was one of his inventions. But one of the things that Lister did was discover that there were these unseen organisms that were causing infections. And back in the day when he was a doc, doctors would do surgeries and they would walk from one surgical room to the next with blood on their hands and blood on their big aprons, and they didn't wash their hands, right? They would just like deliver a baby and then go do a surgery on an infected wound and then go deliver another baby. And guess what? A lot of people were dying because of infections, whether it was in childbirth or doing surgery. And what Lister figured out is that, hey, you know what? If we wash our hands or if we spray some antiseptic solution, this whole infection rate thing drops dramatically. And then he postulated, rightly so, that there are these tiny little organisms out there that were causing these infections and that the physicians of their era were actually transmitting the infections from one patient to the next. When they started to use these, caustic sprays, their hands would get so irritated from a full day of surgery, then they started to wear gloves to protect their hands. And then the infection rates dropped even more. So anyways, even though this guy pretty much proved that this was what was going on, it took a decade or two with really fierce opposition to this idea that there was something going on that you couldn't see that was causing infections that was being transmitted until it became widely accepted. Now, obviously, we think it's like normal. But I think of this with, chronic infections. What he was dealing with was acute infections, obviously, that were bacterial. But with chronic infections causing chronic health problems, we're kind of at this crossroads moment where it's clearly that's what's happening, but it just hasn't been accepted by, and in fact, it's sort of made fun of, really, in the conventional medical world. Just like Lister was kind of put down for a while, it's the same exact kind of phenomena. It just takes a generation or two for people to start to, catch on that these things are important, okay? So all that being said, again, if you can run these labs, consistently treat people for these infections, and you get about 100 cases under your belt, you'll be convinced, as I was, somewhere around the 100 lab mark, that this really, really matters. And the infections that I wanted to talk about today are ones that I see in practice every year on a regular basis: crypto, Giardia, histo, Blastocystis. To a lesser degree, some of the things like roundworm, pinworm, hookworm, threadworm, those are a little hard to find and don't show up as often. And then there's different types of tests, right? There's a standard O&P, where you have someone with a human being with a microscope looking for an infection. You have stool antigen tests that are done widely. If that's positive, then you know you have an active infection. And then you have PCR testing, which is what Diagnostic Solutions offers on the GI map. And the PCR testing is using a whole different testing method, right? It's using DNA to look for that. So now with the old-fashioned O&P, it's a human being and a microscope. And it honestly depends on how much attention they're paying. Like if they were out drinking late the night before and kind of hungover, they're probably not going to find as many parasites the next day. It also depends on how many samples are set in, right? So people have labs that do 2 or 3 or 4 samples, because the more samples you have to analyze, the more likely you are to find these bugs, because they're not shed in every bowel movement. And so PCR testing or DNA-based testing is an attempt to get around this problem of being reliant upon a human being and a human eye to find these infections, which understandably are difficult to find, right? By definition, they're microscopic little things. And, it's not easy for anyone, even with the high level of training, to be able to figure this out. And so in terms of warning signs that can occur, right? Anything from the obvious digestive symptoms, constipation, diarrhea, gas, bloating, those kinds of things. Now, those are the people that are pretty easy to convince to do the test, but then you can also have a whole crowd: joint pain, muscle aches, anemia, that'll be classic, right? Not having enough iron in your body because of the parasites, some kind of a skin-related problem, or fatigue, or immune problem, or insomnia, or absolutely no digestive symptoms at all. Now, the problem is that with organisms like crypto, and each one of the ones that we're going to go through today, I want to break out each of these organisms. You're going to find that some people have depression from Cryptosporidium. I've seen that hundreds and hundreds of times. Some people get crypto and end up having back pain. I haven't seen that hundreds of times, but I've seen that dozens of times. I've seen back pain more than 30 times probably with Blastocystis hominis. I don't know why that one of all of them, but anyways, some people are going to get Cryptosporidium and have, the classic crypto problem is intermittent symptoms, right? So one of my old office manager from maybe when my son was born, maybe 20 years ago, my office manager, Jessica, I hired her. She's great. She's like super smart. She had, hard worker. She just graduated from college. She had spent a year in South America and then came back to the States and wanted a job. And so, the first month on the job, she calls in and she says, "Oh, they're back. I'm getting these migraines and I just can't, come to work for the next couple of days. Every time this happens, I just, have to just lay low, and headaches and all this other kind of symptomatology." So I'm like, okay, that's a bummer. I didn't know that when I hired you, but okay. And then this just kept happening. And by the second month or something like that, I'm like, look, this is kind of crazy. We can test your hormones. I was sure it was a hormone problem because she was a woman and she was happening every month. And we ran the hormone panel and her hormones were fine. And then I ran a GI test, what the heck? And she had Entamoeba fragilis that she had picked up when she was in South America. And turns out that these organisms like crypto and Entamoeba fragilis can have a life cycle, right? Crypto is probably the most notorious one for doing this. And she would get symptoms every 4 to 6 weeks. It seemed just like a menstrual hormone related problem. But as soon as we treated the parasite, that entire cycle of symptoms was gone. Okay, so again, you'll see this with crypto, you'll see this with Entamoeba fragilis, where there's cyclical symptoms. Sometimes they're GI symptoms, but sometimes, like with Jessica, they're headaches, and it seems like something else is going on. Highly infectious intracellular parasite. Most people get it through bad food or bad water. It's a nasty little bug, right? It gets into the cells it goes into the cell, and then it kind of chews up the cell and breaks down the cell that it's in. And then again, it goes in and out of the cells in a migrating cycle. So if you have patients that have cyclical symptoms, whether they're GI symptoms or headaches, or classically just extreme fatigue, every 7 days, 14 days, 21 days, 60, whatever days, on a cycle that seems like every 4 weeks or 3 weeks or 6 weeks, you might suspect something like Cryptosporidium is going in and out of their cells. And when it's flaring up, you're getting symptoms. When it's died down, they're not so bad. Okay. And this is a pretty nasty little bug. There's a little picture of it. Doesn't look like much, but it has a horrific life cycle. As some people can get these infections, this is like true for Giardia as well, in an acute phase, right? Where you're having a shrimp cocktail on the beach somewhere, some exotic location, and it seemed like a good idea because you just had 2 daiquiris and you're kind of happy, and you're not thinking about the fact that you shouldn't really be, eating uncooked food, but you just do it, and you have horrible diarrhea and vomiting for a couple of days. So that would be an example of getting an infection when these organisms are in an active state. But you can also pick up something like Giardia or Crypto in an inactive state where you get a little bit of the organism in you, but it's not causing any acute symptoms, and it just gradually over time starts to completely rip your intestinal tract lining apart. But you just think that you're fatigued, or you just think that your sex drive's no good, or you just think you have this weird skin rash, or you just think you're having food allergies, and you have no conceptual framework that this bug is ripping your gut apart. Okay, now even people that have the acute symptomatology, and this is what happened to me when I was living in Thailand. So when I was, I don't know, maybe 23 or 24, I decided it was a good idea to go live in the jungles of Thailand in a monastery, in this Thai Buddhist monastery called Wat Suan Mok. And then I went to another one. If you're into Thailand monasteries, there's another one called Wat Panana Chat that I went to. And Wat Panana Chat is in the far north, what's the north right-hand corner, northeastern corner of Thailand. And it's very remote, let's say, to put it kindly, and the hygiene not so great, And I got deathly ill while at that monastery from some bad food, and I recovered. I came back down to southern Thailand and where the beaches are and could kind of hang out and relax and kind of get a grip on things, and went to live in a different monastery that was a little more low key. But one of the things that started to happen about a month after I got the parasite, uh, the one that I got was called ehisto. I didn't know this at the time, right? Was I started to develop food cravings. And all of a sudden, these like coconut fried banana things looked really good. I used to eat them every day. They had this cart in front of the monastery, and I would just walk out there in my little monk clothes and give them a couple of baht and get my little fried coconut banana thing. And I had never had a food addiction or food craving problem in my life, but all of a sudden I was like, I don't know, these things are delicious. So then, of course, I got allergic to all these foods, and I started down this whole kind of chronic fatigue path that I was on. So, anyways, you can pick up these infections, and even if you get acute symptomatology like I did, you can have patients that don't really make the connection between their inflamed bowel problems, their chronic constipation and diarrhea, or their fatigue, and the fact that they picked up one of these bugs. Okay, it's not totally obvious. Many, many years ago, almost 500,000 people in the city of Milwaukee got Cryptosporidium all at the same time. And I actually had 2 patients around this time, a little bit after this event happened, that were part of the Milwaukee outbreak. So anyways, it can be, what's even a funnier story? This is not really funny, but it's kind of funny, is that there's the lab, one of the labs I was working for that I told you about a long time ago, they had the lab itself, the physical lab offices where they did the test, right? Where it was in Santa Monica at the time. This is a long time ago. And they had this outbreak of Cryptosporidium in Santa Monica because it got into the tap water. It was in the tap water because something failed. I don't know, some filters failed or something. And the people that worked in the lab were drinking the Cryptosporidium tainted water and testing themselves and finding that they had crypto. They're working in the lab company. Okay, so this stuff can happen, and it doesn't have to be a monastery in the remote jungles of Thailand like happened to me. You can get these infections from tap water. You can get these infections from other people that have them. They're relatively easy to pick up if your immune system can't surveil things very well. Okay. And remember, crypto is the one that most often leads to cyclical symptoms, like every 3 weeks or every 6 weeks, kind of flare-ups of fatigue, but it could be any of these bugs that could cause that, but crypto is probably the most common. Crypto can mimic Crohn's disease, can cause villus atrophy, meaning it damages the small intestine lining, enlarged crypts in the gut, can cause a lot of different problems, okay? And in children, it's particularly nasty, a horrible, horrible infection in kids. So we had I don't even need to make things up. Like the true stories of my life are so weird that I don't even have to have like a fantasy life. I just like tell you actually stuff that happened. Okay. So it was about, again, it's before my son was born. I date everything by that. So it's maybe like 25 years ago. And I was teaching a class, just innocently teaching a class at this naturopathic school. And this woman came up to me at the end. It was an evening course. She came up to me. It was like 7. I can kind of remembering thinking like, I want to get out of here and go get some dinner. I wanted a burrito or something. And this woman was like asking me questions. Like, okay, I'll just stay for a few minutes. And she came up and she says, I don't know what to do. You know, I have a 3-year-old son, or maybe he was 4, like a 4-year-old son, and he's been really sick with this horrible digestive problem. And you know, they can't find anything wrong with him. We're going to all these pediatric gastroenterology specialty people, and they're thinking about doing some kind of an exploratory surgery on him because they just can't figure out what's going on. So I was like, okay, like really, I just want to go get my burrito, and I have no idea. I think he should just see a real doctor. It sounds like he's really sick. So I said, well, what happened and what's been going on and when did it first start? And it was all my same exact questions I always ask, right? Which is, when did the problem first start and what else was going on around that time? So the problem had first started like less than a year ago, and what were they doing? They were camping. And this was when I was down in San Diego. And I was like, where are you camping? She's like, well, we took a trip down to Mexico and we were staying at a campground, and we were drinking the tap water from the campground in Mexico. And I'm thinking, well, that is the worst parenting that I've ever heard of. And as soon as we came back, he had really bad diarrhea, and the diarrhea just won't go away. And so I'm thinking, well, I don't know, like you don't really get like rare genetic disorders of intestinal inflammation that they're looking for now from a campground in Mexico. You probably would get a parasitic infection. So I said, did they check him for parasites? She said, oh yeah, we did all that. But of course, what ended up happening was they did one standard kind of O&P test. The person with the microscope was spacing out that day. They didn't find it. Okay, we were able to run a proper lab, right, a good quality lab, found the Cryptosporidium, and spared that kid a world of pain. It's probably all grown up by now. So anyways, it's very common for these infections to be missed in conventional medicine. They'll typically, with the obvious history like this child had, have, do a little bit of parasitology in the beginning, but they won't stay with it for long enough to really just kind of completely rule out the infection problem. They'll start to go on to other diagnostic categories, and just something to keep in the back of your mind. This is why we can really help people, because this problem, kind of like how Dr. Lister probably felt, right? He's like, wash your hands, use the antiseptic, put on gloves. This is, I'm not making this stuff up. I feel like that now, but from a chronic infection standpoint, right? So Blastocystis hominis. Oh, so much to say about blasto. Anyways, you see this one a lot. I know it can be considered okay, in that some people feel like it's not really that big of a problem, but it's not really on the radar for, heavy duty anti-parasitic drug kind of treatments like some of these other infections might be. But every case of blasto that I've treated, which is every case I've ever found, the person has been very happy that we got rid of this. And I have this general rule of thumb for patients. It seems reasonable in the world that we're living in, for all of my patients to be infection free. Okay, it's a low grade infection. Blastocystis probably hasn't killed a lot of human beings, but it can certainly drag you down and cause chronic inflammation and all kinds of, what we maybe consider minor symptoms, right? Not symptoms that are going to put you into the emergency room, but low level digestive problems can be pretty common with this bug. IBS type symptoms, they can be highly inconvenient if people are having diarrhea 9 times a day or something like that. So again, blasto, it has its own little life cycle, and important to recognize that all these organisms they're parasites, right? They're parasitic, just like the term. Oh, by the way, this has nothing to do with this class, but if you have not seen the movie Parasite yet, probably the best film I saw last year, Parasite. It's based on this Korean family. I don't want to tell you the details of it, but anyways, it's what do you call it? Film noir, I guess. It's kind of like a creepy but really artistically done movie. It's not a horror movie by any means, but it's really great. Parasite. Okay, sorry, that was a little segue. That's nothing to do with this class. But these organisms like blasto, they're pretty hardy, and I do get a lot of feedback from doctors that are in our classes that say it's kind of hard to kill. So blasto maybe brings up the point that you want to be circumspect and careful and strategic about how you get rid of these bugs. So the temptation for sure is to see that there's an infection and then to just want to kill it right off the bat. But that does not work well because these organisms have their own little life going on. They got their own little personal agendas, and they want to keep us alive, you know, so that they can stay alive. And so you have to be really strategic about how you get rid of these bugs. The number one thing that you need to do is make sure that you clean up as many variables as possible before you do the killing phase. So that means that you get the person on the right diet, you work on their adrenals and get them to de-stress, you get them to start to meditate, you get them to start to, get their relationships better, just get them healthier for a few months and work on all the lifestyle factors. And when you feel like their immune system is starting to upregulate, you feel like their immune system is getting stronger, maybe use some immunoglobulin supplements or some glutamine-based supplements or some prebiotics and probiotics or some butyrate or whatever it is that you're going to use. Butyrate is probably my favorite these days. It's one of the better supplements I think that's available. It just came out in the last year or two, so you can get butyrate from a couple different companies now. So do something like that to get their gut ready so that when you start to do the killing, it's more likely to work. And because of the way that I was trained in the GI workups, and a man named Dr. Bill Timmons many years ago, I've not noticed that blasto is harder to kill than anything else, but I get this feedback from doctors coming into our mentorship program all the time, like, I can never get rid of blasto, I can never get rid of this or that. And I think if you do the preparatory work well, and you do the lifestyle work well, and you upregulate the immune system, you're gonna have great results getting rid of these bugs, okay? So if you do have a patient that comes in and they say, I've tried this and this and that treatment and nothing's working for my blasto, just take a deep breath and a step back and think through your strategy so that you have a comprehensive strategy how you're going to get rid of it. Okay, but again, in my opinion, it's always worth getting rid of blasto. If you see it, it can cause all kinds of irritations in the gut lining. And now we're on to kind of like I don't know, the pinnacle or the nadir or the pit of these. I don't know if this is the high point of the talk or the low point, but this is the worst of all the bugs in my experience, in that Entamoeba histolytica can cause the most serious GI problems and the most serious liver-related problems out of all the different infections. Now, of course, it all depends on how strong and healthy the person is, but this is a particularly extraordinarily nasty bug. It's hard to find on the labs because by its very nature, lytica lysis, it slices up. It's the amoeba that slices up into the intestinal wall, into the lining of the intestinal musculature itself, and embeds itself. So it's not in the lumen, it's not in the place where the food contents are moving through, right? It's really hard to find on labs. Even the DNA testing, it's hard to find. So if you ever see ehisto or even a hint of ehisto, even just like someone even mentions the name ehisto, take it really, really seriously. It can go up the bile duct, as can Giardia, can go up the bile duct and into the liver and cause abscesses and problems in the liver. And it's just a nasty, nasty bug. And out of all the GI cases I've had in these gazillions of years of doing this, the ones that really stand out, the really bad ones, that when they stand out, by stand out, I mean that I couldn't get them better very quickly. It took like a year or two to really help the person. Ehisto is just prominent on that list, I would put Giardia, ehisto, and crypto on that list as the hardest to get rid of, and ehisto being, by a factor of 10, like harder than any of the others. So if you see it, again, just think through your strategies. I've never had a case where we could clear it only with herbs. Every case I've ever had of ehisto, we had to resort to medications as well as natural treatments. Maybe that's just me and bad luck, but it's not an easy one to kill. There's some really great medications for it. There's one drug called Alinea that a lot of my medical doctor friends use for ehisto, and it's incredibly effective. But it's not an easy thing to kill, even if you're using drugs and herbal support. So be on the lookout for this one. It has extra importance. And then if you ever see ehisto, And this is an old Timmons trick. Dr. Timmons taught me this, and I think I've used this trick. It's not a trick. This piece of information, I think this has been relevant 3 times in my career. So about every 10 years, this has been very important. And I'll pass this fact on to you, which is that E-histo, even more so than Giardia, I believe, can cause major problems with the liver. So Giardia can get up into the bile duct, but E-histo I know can get into your liver and cause an abscess in the liver, which can be very dangerous for people. And so it's one of the reasons why if they have an amoebic abscess and their gut is completely ripped apart, the antibiotics seem to be required to really handle this thing. And so be on the lookout. You can't just like dump a whole bunch of artemisia into someone's body if they have E-histo and their liver's not in good shape. So this is one you just really want to be careful. And I'm a chiropractor by training, so I always work with medical doctors to try to sort out these more complex cases. And my old buddy Morgan Camp and I have done a bunch of E-histo cases together. He'll do the medications, I'll do the herbs, person goes back and forth, and eventually we'll get the upper hand here. All these infections we're talking about today can result in food allergies. So if you have patients coming in and they're getting more, and now there's different kinds of food allergies, obviously, right? There's like, my son is allergic to kiwis, and it's not because of a parasite, he's just allergic to kiwis. If he eats a kiwi, he throws up, and that's figured out, his mom and I figured out that one pretty fast. Some people are allergic to, I don't know, nightshades, or some people are allergic to oranges, or whatever. So some people are just born with food allergies, and that's just what their body's doing for that particular food. But when the person is acquiring food allergies, and when the food allergies are mounting and getting worse and worse and worse, exponentially so, oftentimes that means that there's some kind of parasitic infection going on, like Giardia or E-histo or Crypto. And those really bad parasitic infections damage the gut lining and the immune system so much that we start to get sensitive to foods. And when I think back again on my E-histo patients who had E-histo for a decade or two, most of them, almost all of them, came in with the main complaint being, I can only eat like pineapples and melons and turkey now. Everything else I eat makes me sick. Or unless I do an SCD diet or an autoimmune paleo diet, I can't function. They're on some kind of real extreme kick with food because of the damage that's come about from an infection like E-histo, Giardia, or Crypto. Those are the 3, again, that in my mind stand out as causing the biggest problems. And look out for liver of people with E-histo. Maybe every 10 years you'll see this too, where it makes a big difference to warn the person that they may have an issue with their liver going on if they have E-histo. And obviously get it checked out by conventional medical testing. So again, all these organisms have this life cycle. They're doing their own thing. They're living and dying and reproducing, and I guess they're kind of like freeloaders because they're doing it off of our food and our energy and everything. But you certainly don't want them to continue this life cycle. And Giardia, second most prevalent waterborne parasite. You see, I mean, if you're practicing in the United States, Giardia is all over the U.S., right? It's common. You don't have to go anywhere fancy on a vacation to get Giardia, and it's highly infectious. It's easy to get it. You can get it from bad food or bad water. You can get it from cats and dogs. I don't know. I've tested only like 3 veterinarians in my whole practice life, and I think 2 of them had parasitic infections. One had Giardia and one had Crypto. And you want to know the funniest thing in the world? This happened like 10 years ago. I tested this veterinarian that was a patient, and she had digestive problems. We ran this lab, and she had Giardia, and she looked at me and she said, I know what patient I got that from. But she meant a dog, right? Not a human being. I was like, whoa, she had a dog that had Giardia. That's so cool. And you got it from your patient, but your patient's a dog. I don't know. I thought that was funny because just the idea of thinking of a dog as a patient was so hilarious to me. But anyways, you can get this from animals. That's the point. You can get this from humans. I guess humans are animals too. You can get this from pets, or you can get it from human beings. Most of the time, I think it's human to human contact, right, that's doing this. And it's a doozy, right? This one just rips the small intestine apart so bad, and it attaches to the bile duct and to the liver. It can mimic gallbladder disease, meaning you're not absorbing fats real well. This is disgusting but true. The cyst form, right? The inactive form, like the little egg form, right, can live under your fingernails for 6 months. So scrub your fingernails really good tonight before you go to sleep. And if one person in the family gets it, everyone can get it pretty easily. If they're sharing a kitchen, couples can, pass these infections back and forth through sexual contact or through cooking and sharing a kitchen. And so I do have I do strongly suggest with couples that they test the partner, if we have something like Giardia or Crypto or H. pylori. And what the heck, we should just make sure that if we get it out of the family, get it out of the household entirely all at one time and not just kind of, mess around and tinker around with it, okay? And then Giardia's got its own little special thing. So Giardia, I guess because of the way it attaches to and damages the small intestine villi, you can get a lot of chemical toxicity problems, chemical sensitivity problems with Giardia, and it interferes with fat absorption, and then you don't have the right levels of fatty acids, and then your cell membranes aren't so great. Not only the food allergies, but with Giardia specifically, you often see chemical toxicity problems and real sort of extreme reactions to environmental chemical exposure, as well as obviously all the GI stuff that can go on. Not a fun one. And that one is susceptible. You can use medications. There's a series of medications you can use for Giardia. You can also, get rid of it with herbs. People go either way on that one. I think that one's pretty commonly treated with medications. It can trigger symptoms that are like IBS. It often causes this environmental sensitivity, chronic fatigue type state, issues. You can get it from other people, like in this case, childcare workers. You can get it from changing diapers, from other human beings. And it's a pretty common infection. Horrible. And here's the thing, the classic symptoms of Giardia are really bad smelling intestinal gas and bloating. But I don't know, the vast majority of people that I've had with Giardia don't have any of these obvious Giardia symptoms. That's why it's so hard to deal with. And then we have roundworm. These bugs are hard to find, but when you do find them, man, that can make a huge difference for people. This one is easy, or these kind of worms are easy to treat, and I would say sort of, for the amount of ease of the treatment, kind of life-changing for people to get rid of them. So that one's always on the lookout for that. And the treatments are really straightforward. And for roundworm, there's a couple of medications that are used that are pretty effective. You can use herbs, but it always seemed like a waste of time to me to use herbs because the medications you just give either for 1 day or for 3 days, and you get rid of this whole thing and do it again a few weeks later and it's gone. Entamoeba fragilis, I've seen a lot. I don't know, probably had like 4 or 5 Entamoeba fragilis cases in the last couple months. I don't know why. This just kind of comes in waves, I guess, but this one comes up a lot. So this one is on the border, like some people treat it with medication, some people treat it with herbs. I kind of let people choose what they want. Endolimex nana is a curious one because it's pretty easy to kill. And in some people, I find it's just super mild symptoms, like almost nothing. And then some people, even though it doesn't seem like a big deal kind of bug, can cause a lot of fatigue and headaches and, just, feeling unworthy to be alive kind of feelings. So it's worth getting rid of Endolimex nana, but it's easy to get rid of, as is Entamoeba coli, with the herbal programs. I don't think people use medications for those very often. The one sort of clinical tidbit too, while we're on this topic, is some things that you should just know in the back of your mind, is that Entamoeba coli. So it says E. coli here, but they're not E. coli the bacteria, right? We're talking about Entamoeba coli. Let me show you here. This guy here, Entamoeba coli, not the bacteria E. coli. So they're abbreviated the same way, which is kind of confusing, right? The amoeba. This is the amoeba. That can be a partner or co-conspirator with Entamoeba histolytica, which remember I said is the worst of all these. So just keep that in the back of your mind. If you see Entamoeba coli, not E. coli, but Entamoeba coli, just wonder, is there any possibility this person has E. histo? Because that's the Mac Daddy extra bad, worst version of all these different infections, okay? And then, again, Endolimex nana and Entamoeba coli, not too hard to kill, although sometimes the symptomatic relief can be pretty significant. So these are the bugs, again, you're thinking about the ones that show up, crypto, ehisto, Giardia, Blastocystis, Entamoeba fragilis, Endolamex nana, Entamoeba coli. I see all of these, except for the ehisto, at least once a year, maybe some of them I see like the D fragilis maybe once a month almost. Getting common with them and familiar with them and understanding like, should I use medications? Should we do herbs? Do we do a combination of both? It's something to think about. And so like when, working with Dr. Camp all these years, there's many different approaches you can take. So you can, for example, start with an herbal program, let's say it's Giardia, and then work on the adrenals, work on getting the inflammation down, and then segue over in a month or two to doing an antibiotic to get rid of the Giardia. So you can do both, starting off with the natural program and then ending with the medication. You can do the exact opposite. You can do the medications for Giardia first, and then because you can only take those for a week or two at the most, 7 days or 10 days, then you can do a couple month follow-up program to get rid of the rebound yeast overgrowth from the antibiotics, to get rid of any remaining Giardia. What you want for a lot of these organisms is a pretty long killing period, and if you're using medications, sometimes the amount of time you can use the medications is really short, like 3 days or 7 days or 10 days or something like that. Some of the drugs you can take for 2 weeks, but most of them are generally recommended to be used for a shorter period of time. So you can bracket the natural programs either before the medications or after, so you have a longer killing period. Or in some patients, you'll find maybe it's Endolamex nana, and there's really not medications for it necessarily. You can do the whole thing with an herbal program. Or you might have someone who has crypto, but they're really against antibiotics because they took antibiotics so many times in their life already, and they don't want to do another round of medication like that unless they have to. So you can always start with an herbal program for a couple months and then escalate that to medications if you have to. And the way that you know that it worked is you simply retest at the end of the program. So, you're never going to be left wondering, did that really work or not, if you do the retesting and you make sure that Giardia is gone or the crypto is gone. So what you're looking for obviously is a reduction of patient symptoms or elimination of symptoms, and then a retest that shows that the infections are clear. And if you have that safety net of retesting, then you don't have to worry about using the herbs and it not working because you're going to know. Okay. The downside to the herbs are that they're expensive because you usually have to give at least 2 or 3 different products for 2 months, and it can cost $400, $500, $600 to buy all that stuff, 2 months worth. The downside to the medications are that they're antibiotics and they can cause rebound yeast overgrowth. Sometimes people don't handle the medications very well. They can be hard on the liver. Some people get sick from them. Advantages to the medication though is that oftentimes insurance companies will pay for them, so they're less expensive. If it's let's say it's a woman and she wants to get pregnant in 2 months, maybe she doesn't have time to do this long herbal program, and a week of antibiotics may seem like an attractive option, So there's many different cases where, depending on what makes the most sense for the patient, you can either combine antibiotic then herbs, or herbs and then antibiotic, mush them together, or you can do one or just the other. And all these years of killing these bugs, I've tried so many different approaches with so many different medical docs and different clinics I've worked with and all the people in my training program. I really don't think there's any one surefire way to do this that's the best for everybody. The only thing that I have seen consistently is that with the really bad ones like ehisto, that the medications need to be in there somewhere, and with the ones like roundworm, hookworm, threadworm, that because the medications are so quick and easy, that it just kind of makes sense to do them, instead of just relying on a long-term herbal program. And so we'll talk about this for a minute, and then I'm going to show you some sample labs, and then we'll open up for questions. So again, if you came in late, we have a couple of new courses that I'll be teaching. I've been working on the curriculum for these for 4 years. That's not an exaggeration, literally for 4 years. I'm very excited they're finally coming out. I've been talking about them and thinking about them for 4 years. The first one is amino acids and vitamins. It's deep dive into how to test and correct amino acid and vitamin problems. We're looking at athletes, chronic fatigue, depression, anxiety, and insomnia as conditions, right? And really understanding how you can prescribe amino acids and B vitamins to make patients change, significantly in dramatic and wonderful ways. And then in June, we have a second boot camp that's on genomics, and it's again about how to combine the functional medicine lab work that we do in terms of amino acids and B vitamins and connect that with methylation SNPs and SNPs related to CompT and all the SNPs to do with the brain and the B vitamins and all this, and getting a sense of how that ties together, the genomic part and then the functional medicine part. And if you're listening to this, you can get a 20% discount on either of these courses. They're both 2 months long, and they both have 4 live calls. They both have a very significant set of lectures from my teacher, Dr. Richard Lord, who's supposed to be in retirement, but works 7 days a week. I just spoke with him this morning. I'm talking with him in about another 15 minutes. We're working on fatty acids right now. That'll be out next year, okay? So all these classes, these boot camps have Richard Lord speaking. And for those of you that don't know Richard, if you're newer to our profession, he's the scientist that developed the integrative medicine organic acids tests, amino acids, fatty acids. He developed a whole lot of things in his career on a lab analysis. And I've been working with Richard really closely for 4 years now. It's pretty cool stuff. So anyways, these 2 things are coming up. And if you're interested, you can join us for those. And you get a nice discount, which lowers the price down quite a bit. And then let me show you here a couple labs. Now, honestly, this is not that hard. The hard part is convincing people to do the test, right? That's the hard part. But the interpretation here is pretty straightforward. So if you're looking at a diagnostic solutions GI map, and again, we're going to open it up for questions in a couple minutes, so get your questions ready. And you go to just the section that says parasites, crypto, ehisto, giardia. That's the first thing I look at on these. If any of those is positive, game on. You got some work to do. And this may sound like creepy and twisted, but I actually get excited and am happy, not like gleeful, but like happy in a like I got something to do kind of way. If I see crypto or ehisto or giardia positive, I'm like, okay, this is going to be good. I'm going to help this person. I know I can help them. I know I can kill these guys. I know I'm smarter than Cryptosporidium. Okay. There's an H. pylori that's kind of borderline. And H. pylori is very commonly paired with, for reasons that are beyond my understanding, other bugs. These are opportunistic bacteria. And then we have this last section of parasites. They're separated out. The pathogens are up top, and then the protozoa are right here, Blastocystis hominis. So you got to look in those 2 areas. And here are the other ones I talked about, blasto, positive on this test, defragilis, Endolamex nana, Entamoeba coli. Again, that's not E. coli, that's an amoeba, that's Entamoeba coli, another bug. Okay, now, same thing here. Look at the test, just so you get familiar with how to do this real quick. Believe it or not, I have people come in with these labs from other doctors and the doctor missed the infection. I'm not kidding. This happens every year. Like someone will come in and I'll be like, oh, so you already had the test done. Let's look at it. I'm like, did they treat your Entamoeba fragilis? And the person's like, no. I'm like, okay, well, I don't know what to say about that. I never put down other doctors, but I'm thinking, wow, how could you miss that? It's right on the lab, people. So look at the first page first under pathogens, crypto, ehisto, giardia. Always look at that first. If that's clear, you take a deep breath and go, okay, well, that's not going on. But then don't forget, you're looking at the other parts of the test that relate to parasites. You're kind of skipping by all this great commensal bacteria and dysbiosis markers. And the reason why I look at them this way is because this is the way, the order in which I want to treat. So if you have a major parasite that's present, I was taught by Dr. Timmons to treat that first, to come back later and deal with the candida and the dysbiosis and the other stuff, okay? So I was always taught to treat the Giardia, crypto, or Giardia, crypto, or ehisto, or in this case, you can see D. fragilis. I would go after that first before I went after any dysbiosis or any yeast. These are considered the primary infection, the way that I was trained in sort of naturopathic world. And if you get rid of that primary infection first, you're going to have a much easier go of it. And we'll look for one more here. Again, you scan through. And the first thing I do is look at these bugs. These are all clear. Crypto, ehisto, and giardia. Oh no, giardia. I mean, that's the end of the story for me. Now I know exactly what I'm going to be doing for the next 4 to 6 months with this patient. Now, of course, I look at the rest of the test, but Giardia has got to be dealt with up front, okay? Got to be dealt with up front. Let's see what else is on here. Oh, an endolamic nana. I would say anything that you do to get rid of Giardia is probably going to clear out the endolamic nana. That's the one I mentioned earlier. It's not too hard to kill. And the Giardia, you really have to take a consideration of whether you want to do antibiotics or herbs or some combination. Giardia is in that category where, for a lot of people, it makes sense to do the medications. All right, so I'm gonna open it up for questions if you guys have any questions about all this good stuff. And don't forget, we have boot camps coming up if you're interested in those.
All right, yeah, we do have time for a couple of questions. The first question we have is, would you treat parasites or H. pylori first?
I really just have done exactly exactly what Tim has taught me all these years, and it's worked so well. I'm sort of superstitious, knock on wood, to change it. So he always said H. pylori first, and then parasites. But if you have no H. pylori present, then parasites first before yeast, parasites first before dysbiosis, etc.
Okay, great.
Oh,
The
can I
next,
say one more thing about that?
yes.
And not at the same time. Like, don't try to get rid of H. pylori and a parasite at the same time. That just goes badly. It's unfair to the patient. It's too high risk that it'll make them sick and it won't work. And then you won't get either.
Okay, thank you. The next question we have is, how do you treat parasites that are co-infectious with Lyme disease, such as Bartonella? They tend to be more stubborn. Do you treat the body first, such as Candida, mold, etc., before the parasite?
I have a very close friend who's a Lyme disease expert, Dr. Sanjay Schweig. And if they have Lyme disease, I just send them out. I've never treated a Lyme patient in all my years, ever, because it's such a complicated condition. And it involves so many complicated things. And the other things is that Sanjay is a medical doc, and it often, maybe almost always, requires medications. And I feel like I co-manage a lot of cases, like I've said, like eHisto. Dr. Camp and I go back and forth. I'll say, hey, look, Susan or whatever her name is, you're going to go see Dr. Camp. He's going to treat the eHisto with medications, but I'm going to do all the adrenal and herbal programs, And so the medical doc that I refer out to is just doing antibiotics for that one infection. But with Lyme disease, I feel like it's such a complicated thing to manage that I want the person to see a Lyme disease expert. So I just send out for that 100% of the time.
Okay, great. The next question we have says, I have heard the chronic parasitic infections can be due to environmental toxicity, such as heavy metal toxicity. Have you heard this or had cases like this? Also, if someone has both, should parasites and the heavy metals be treated at the same time?
Well, you never want to treat heavy metals and parasites at the same time. That'll for sure be a high risk of making the person really sick. In general, you want the intestinal tract working pretty well so that person can detox the metals effectively. So in other words, if the person's got eHisto and Giardia, and then you try to do a heavy metal detox, a lot of the metals or chemicals that are coming out of the tissues are, well, there are only 3 exit routes, right? You're going to either sweat them out, you're going to pee them out by being well hydrated, or they're going to come out through your liver and gallbladder and in a stool. So you need a pretty highly functioning gut in order to successfully do detox without people reabsorbing and just getting sicker from the detox process itself. You don't have to have a perfectly functioning gut. That's probably not realistic, but you don't want a major gut problem. You want to solve the major gut problems before you do the more aggressive detox. And then I think the first part of the question was more like why do people have these parasitic infections in the first place, right? It's some combination of exposure, but we're all exposed to these every time we go to a public restroom and touch the doorknob, right? It's a combination of exposure and susceptibility, host susceptibility. So if your immune system, well, there's an experiment they did a long time ago. I think this was in the 50s because they couldn't do this kind of thing anymore. But they took a group of prisoners and I think there's like 20 or 30 of them or something like that. And they gave them all a glass of water with Giardia in it, you know, which is kind of gross when you think about it. And they all got sick. Of course, they all got sick. And then they tracked their secretory IgA. And the ones that had really good secretory IgA got sick, and then they got better. And the ones that had the lower their secretory IgA was at the time they did the Giardia exposure, the more likely that Giardia would become a chronic long-term infection. Meaning that it's the host's immune system that determines the outcome of the severity of these parasites. Like if I went to, if I drank a glass of water right now with Giardia in it, my immune system should say, oh, make me really sick, throw up, vomiting, nausea, diarrhea for a few days. And then in a couple of months, it should be gone completely if I tested myself, right? If my immune system was stressed because I ate a bad breakfast, was in a bad marriage, and didn't exercise ever, then, it could be Giardia for, 20 years. That, and heavy metals are part of that equation, right? But it's bigger than just heavy metals that could trigger this.
Okay, great. Thank you. The next question says, it sounds like testing seems so important when it comes to parasites because they can be hidden and mimic many conditions. Do you commonly see parasites where you weren't expecting to find them?
Oh, like seriously, every week of my whole last 20 years, yeah. Like, and okay, so that's one thing. But what's even more intense is what gets better when you treat them, What are the things that can get better when you treat Giardia? And it's not what you think, because we all have our preconceived ideas about how these kinds of things should go down. And we're like, okay, well, I understand that your IBS is gone now. That makes sense. But your sex drive is back? Well, that's a little weird. Well, yeah, because Giardia, remember, it interferes with fatty acid absorption, and you make your steroid hormones, your sex hormones are all made from fat. So, it could even be something as, oh, you know what? I've seen this like at least 5 or 6 times, and it just freaked me out every time so much that it just stuck in my head all these years. Pregnancy. Woman's trying to get pregnant for a couple years. We get rid of the Giardia or crypto. Next month, she's like, comes in and says, I'm pregnant. I'm like, wow, how's the hormone program going? Didn't even get to the hormone program yet, Dr. Kalish. What happened? All I did was the crypto treatment you told me to do. So suppression of hormones, I mean, just things you wouldn't think of that are kind of profound, in terms of how they impact people's lives.
Okay, great. This question says, I have a client with the Giardia infection. Do you know if the spasm in the esophagus can be caused by that?
I don't know. I'm not sure. I've never heard of that before, so I'm not sure.
Okay, and one last question. Can Cryptosporidium be treated naturally?
Yeah, now crypto's kind of hard to kill, right? Because remember, it's the one that goes in the cells, and when it's in that phase where it's inside the cells, it's hard to get at it. And then it goes out. So if you're consistent, you can get it with the herbal programs, but you have to be consistent for like at least 2 complete 30-day cycles. So 60 days of the herbs, the crypto will cycle in and out of the cells enough times then that you could potentially get it. But it's one of those bugs, if there's a reason why the patient's in a rush or, it's a college student and they're just not going to take herbs for 2 months or whatever the situation might be. It's one of the ones that you can definitely get a prescription for if there's a reason to speed things up and you want to use the medications.
Awesome, thank you so much. That's all the time we have for today. Thank you everyone for attending, and thank you Dr. Kalish for a great presentation. We are looking forward to having you back in May for episode 3 of Health Optimization with the GI Map.
Thank you, appreciate it.